Hello, friends. Are you someone who is having that constant fear of getting stroke attacks or heart attacks? Yes, it's common because these days, even people in their early 30s and 40s are easily getting stroke attack and heart attack thanks to our lifestyles. But that's not the problem. The problem is we are not aware about what are the things that we should do in order to prevent the stroke attacks. The things that I'm going to share with you in today's video are some simple but very important lifestyle practices that helps in preventing stroke attack. So if you are someone who wants to know this, make sure to watch this video till the end. Let's begin. Friends, stroke attack majorly happens of two types. One is called as ischemic stroke attack and the second one is a hemorrhagic stroke attack. What's the difference between these two? The ischemic stroke attack basically means that there is lack of blood supply to the arteries that are present in your brain. Majorly, if you are a cholesterol patient or as if you are having cholesterol, high cholesterol, then plaques of cholesterol or as fat tissues gets deposited in your arteries. Sometimes these plaques gets dislodged and get stuck around the brain arteries or on other arteries of the body. When the artery gets blocked due to this cholesterol or fat plaque, at that time there is a lack of blood supply that will happen in the certain areas of the brain. This will lead to lack of oxygenation and will lead to cell death. This type of stroke attack is called as ischemic stroke attack. The second type of stroke attack that happens is called as hemorrhagic stroke attack. What does that mean? This is where your blood pressure raises so high that it causes disruption or breakage of the arteries and there is a blood flow very similar to a cut that happens which leads to hemorrhage, at the same time causes damage to the brain cells and leads to stroke attack. So if we go backward and try to understand in either of the cases, if we have to prevent the stroke attack, then the two culprits that are causing this needs to be solved. What are these two culprits? Number one is food that is very high in saturated fatty acids, which causes cholesterol or as fat deposit in your blood vessels. And the second is high blood pressure. High blood pressure again is very common if you have high cholesterol level, high level of stress in your day-to-day life, at the same time if your body is not getting enough amount of physical activity. So these are the two culprits that leads to stroke attack. And hence, if we have to correct them, 5 tips or 5 things that definitely we should do is number 1, make sure to take care of your dietary habits. Diet plays a very crucial role when it comes to your lifestyle management and prevention of lifestyle diseases. High blood pressure and cholesterol, both are lifestyle diseases. And if we want to control them, then your diet should make sure that they are rich in the good nutrients, which is your proteins, vitamin B12, D3, calcium, minerals, etc. and very low on the fatty acids or is the bad fat that you can say, which leads to cholesterol deposits. The second thing that you should keep in mind in order to prevent your stroke attack is keep your regular blood checks as a common practice. Whenever you do your regular blood checkup, you will be aware of what is the level of cholesterol or other major important vitamins deficiency that could happen in the body, which could lead to future heart attacks at the same time stroke attacks. That's why make sure that every 6 months you go for a regular blood checkup and see a physician in order to maintain a proper balance. The third thing that you should definitely do is to have relaxation practice as a habit. Doing a simple meditation or else listening to a calming music could be a great way for you to relax and calm yourself down. As our lifestyles are getting busier day by day, the workload, the pressure, the FOMO that's associated with the things happening around us makes you more prone to develop stress very easily. The stress is good for your body, but to a certain extent. If you're not able to separate the good stress from the bad stress, that is going to cause an impact. With mindfulness practices only, you will be able to bring that gap. That's why make sure to have good relaxation and mindfulness practices. The fourth thing that you have to do is to make sure that you have adequate amount of sleep. Sleep allows your body to heal from all the stressors and the injuries that your body go through. Injuries not only happens on your muscles, tendons, but sometimes high blood pressure is also somewhere injuring your blood vessels. That needs to be prevented and needs to be corrected. With adequate rest, we can achieve that. So make sure to have good 8 hours of sleep on a daily basis. The fifth thing that you need to keep in mind is to do moderate level of physical activity on a day-to-day basis. This could be a simple walk, jog, cycling, or anything that you like. But make sure to go gradual. Don't overdo the exercises, because overdoing the exercises also increases very high level of stress in the body. So these were the general 5 tips that you can practice on a very regular basis. But one thing you should keep in mind, that the type of strokes both are having are going to come as you age. So as your aging is progressing, at the same time, the risk of developing all of these things are increasing. The best way to prevent this is to act sooner and act faster. That's where knowing certain signs and symptoms of stroke attack is also important. So the immediate sign that you will get when you are about to get stroke attack is a very severe headache. If you are getting very severe headache, definitely make sure that you need to check with your doctor. If you feel that your hands are getting weaker, you are not able to lift the hand easily and they are just falling off the ground, then that is also a sign of a stroke attack. The third sign is slurring of the speech. If you feel that you are not able to talk, your words are not just being articulated, that could also be the sign that you are about to develop a stroke attack. And last but not the least, if you feel that your face is drooping to one side, then that's also a sign of stroke attack. In all of these cases, this is a medical emergency. You should definitely not take it lightly. Go to a doctor, go to an emergency room if required, get yourself checked and act on this fast. Because the sooner you act, the better the chances of your recovery. So friends, to summarize, make sure to have a healthy lifestyle in order to prevent stroke attack. Healthy food, mindfulness practices, good sleep, physical activity are some of this. Next thing, going for regular checkup plays a very crucial role, and identifying hemorrhagic stroke and ischemic stroke both could be at a higher risk in certain scenarios. If you have very high cholesterol level, definitely the chances of ischemic strokes are high. And if you have got high blood pressure, then the chances of hemorrhagic stroke could be high. So make sure that you work on both of these things. I hope you found this video informative. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to the channel. And see you in another video. Thank you.